This is a disposable blue suction tip. Again, something that's good to have in your practice. I don't use this routinely. We do have it on hand. They have a very, very small tip on them, so very, very tiny lumen, which again, it's great for getting right down into the base of, say, a lower third molar flap so that you can get all the little bits of debris out when you're irrigating at the end of surgery. It's not something that I would typically employ during your procedure because it just plugs up way too easily. So definitely have a little bit larger lumen, probably like a green tip if you've got disposable ones, or even better, like a metal reusable surgical suction would be the way to go. So again, something to pick up. They're relatively inexpensive, good to have on hand, and they're also really great if you have like a tiny little root tip somewhere that maybe you need to try to retrieve and you don't have room to get an instrument down beside it, and you want to be really careful. You can slip this right down and it'll go right to the base of the socket, which again is kind of a nice luxury to have, where you can kind of suction onto that root tip to try to displace it a bit, get it back up where you can tease it out from the socket. So that would be, maybe say on the lower, if you have a root tip that you're kind of pushing on and it happens to slip almost through that bone or getting in a place where you don't really want it to go into that submandibular space, you could try something like this, just if it is available. So keep one of these on hand, give it a shot. It's a great thing to employ routinely, like I said, for your flaps, to get way down into the base of that pocket, like down where the bone meets the base of your pocket that you've opened up, to get every last little bit of bone, chip, and debris out of there.